Hey, it's Medicosis Perfectionalis, where medicine makes perfect sense. We continue our biochemistry playlist. In the previous video, I've talked about vitamin B9 or folate. Today, I'll talk about vitamin B12 or cobalamin. Why do we call it cobalamin? Because it has cobalt in its chemical structure. And with that said, now let's get started. Here is the outline of today's lecture. We'll talk about vitamins in general and then vitamin B12, the chemistry of B12, sources of B12, metabolism and deficiency of B12, causes of that deficiency, the clinical picture of that deficiency, signs and symptoms, how to diagnose it, how to treat it, what is the differential diagnosis of vitamin B12 deficiency, and some pearls for the pros. For the gazillionth time, vitamins, we call them vitamins because we thought that they are vital amines, but that's a wrong name. They are micronutrients, they are essential, which means your body cannot make them. Therefore, you have to eat them in your diet. And we divide them into water-soluble vitamins. These are the vitamin B's and vitamin C, fat-soluble K, E, D, and A. Today's topic is vitamin B12. It's here. It's a water-soluble vitamin. Therefore, what? Deficiency is more likely, but toxicity is less likely. Most of the water-soluble vitamins are not stored, except folate and B12. The liver can store B12 for years. Let's talk about vitamin B complex. We have 8 members in this family. B1 is thiamine, B2 is riboflavin, B3 is niacin, B5 is pantothenic acid, B6 is pyridoxine, B7 biotin, B9 folate, B12 cobalamin. So where the flip is cobalamin in this multivitamin bottle? It's about, where is it? Where the flip? It's here, vitamin B12. That's the cobalamin.
But hey, Medicosis, they say that this is 750% of your daily requirement. Is that
Dangerous? Oh, calm your butt down. This is a water-soluble vitamin. Translation: toxicity is less likely. If you take an excessive amount, your kidney is gonna get rid of the excess and everything will be hunky-dory. Thiamine is important for dehydrogenase enzymes, B2 and B3 for redox reactions, B5 is for anything that has the coenzyme A, B6 is for the transaminases, B7 is for carboxylases, B9 is for transfer of one carbon unit and DNA synthesis, B12 is the isomerases, the mutases, anything that is a methyltransferase, and DNA synthesis. Some synonyms. B12 is the same thing as cobalamin. It's the same thing as anti-pernicious anemia factor because vitamin B12 deficiency is called pernicious anemia. If the problem is in your stomach, it's like an autoimmune disease. More than that later. Animal protein factor. You find it in fish. Clams are the best source of vitamin B12, man. Also mussels, mackerel, beef, chicken, etc. It's also known as the extrinsic factor of Castle.
Why the extrinsic factor as opposed to what?
As opposed to the intrinsic factor made by your stomach. So in order for you to absorb a vitamin B12, you need two things. You need vitamin B12 from the outside, it's called the extrinsic factor, and something from the inside called the intrinsic factor. Cobalamin structure, it's called cobalamin, so it has cobalt in it. So 4 chiral rings, 1 cobalt molecule, and 1 phosphate group. If you are a biochemistry nerd, this is similar but not identical to porphyrin. What are the different types of vitamin B? So the quintessential prototype is just the cobalamin. Add a cyanide ion to it, becomes cyanocobalamin. Add a hydroxyl group, hydroxycobalamin. Add nitrogen dioxide to it, nitritocobalamin. Chlorine, chlorocobalamin. Sulfate, sulfatocobalamin. Let's say I had vitamin B12 deficiency and I'm sick, so I said to my mom, Mama, I am ill. Get me the doctor to give me the pill. Hey doctor, can you give me some vitamin B12? Sure. The doctor usually has 2 options, cyanocobalamin and hydroxycobalamin. Which one is better? Look, both are okay. Hydroxy is slightly better. Why? It's more active and it lasts longer in your body. Cyanocobalamin, if you are really deficient, you have to go to your doctor once a month for a vitamin B12 intramuscular shot. But if it's the hydroxycobalamin, you have to go every 2 to 3 months. It lasts longer. There is a great textbook of medical biochemistry by Chatterjee and Shinde. It is really fascinating. Other textbooks of biochemistry need to get their heads out of their sphincter. Here is how Donald J. Trump would describe this book. I know a lot of biochemistry textbooks. They are fantastic. Excuse me. One book, however, is second to none. It's written by Chatterjee and Shinde. It comes from India. What a tremendous book, written by some tremendous people. Excuse me, you're fake news. Totally fake, totally dishonest. Anyway, the book says the main storage of vitamin B12 is the liver. Let's talk about vitamin B12 metabolism. What's the extrinsic factor? Vitamin B12. So you eat vitamin B12 in a clam, mussel, beef, chicken, whatever. This purple part is the vitamin B12, the cobalamin. This green square is the animal protein bound to the cobalamin. In order for you to utilize and absorb cobalamin, you need to get rid of this animal protein component. Who does this? Your salivary amylase. You need your salivary glands for two things. Number one, amylase to sever this relationship between the cobalamin and the animal protein. #divorce, and to supply you with cobalophyllin. I love this word cobalo because cobalamin. Phylin, to love. I love cobalamin so much. It's like hemophilia. Hemo, blood. Philos, love. It's like philosophy. Philos, Sophia. I'm such a multilingual guy, it's unbelievable. Now, cobalamin is free from the tyranny of the animal protein component. Cobalamin will bind to cobalophyllin, which is the R protein, which is the haptocorin, which is trans-cobalamin 1, the transporter of cobalamin type 1, or number 1, because there is number 2 coming soon from the liver, not from the salivary gland. Okay, where does the marriage between the cobalamin and the R protein happen? In the mouth? No, it happened in the stomach. Why? Because we still require HCl from the stomach. Okay, fine. Now the cobalamin will bind to the R protein. Wonderful. And then we go until someone else, another freaking amylase, but this time it's the pancreatic amylase, not the salivary amylase. It's gonna sever the relationship between the cobalamin and the R protein, #divorce. And then this beautiful cobalamin will bind to something called the intrinsic factor. Where the flip does the intrinsic factor come from? It came from the parietal or axanthic cells of your stomach, in the cardiac and the fundus areas of the stomach, not the pylorus. The pylorus does not make any intrinsic factor. Alright, now we have the cobalamin with the intrinsic factor. Alright, we're still in the lumen of the gut. Now we need to be reabsorbed into the bloodstream in order to go to your liver to be stored and go to other organs in order to function and help with DNA synthesis and cell division and so on and so forth. How will we get absorbed? Okay, you'll get absorbed here in the terminal ileum. And now the cobalamin will leave the intrinsic factor and jump on trans-cobalamin number 2, which came from the liver. The liver supplied trans-cobalamin 2, and cobalamin will say, you know what, I'm gonna return your favor, liver. I'm gonna be stored in you for years. If you wanna be a good doctor, bring a blank piece of paper and write everything here and draw it again. Some mnemonic from the great Ellie of New York. Iron, folate, and cobalamin. Where do they get absorbed? Here's the mnemonic. First, you iron your clothes, and then you fold them, and then you put them in the closet. So first you absorb the iron in the first part, which is the duodenum, and then the folate in the jejunum, and then the cobalamin in the terminal ileum. What are the sources of vitamin B12? We have natural and we have artificial. Let's start with the artificial supplements. We have fortified foods such as fortified cereals, fortified yeast, multivitamins, cyanocobalamin, hydroxycobalamin, available as oral pills, nasal spray, nasal gel, intramuscular injections, and subcutaneous injections. Let's talk about the natural source. First, let's get this out of the way. Only bacteria can synthesize vitamin B12. Humans cannot do it, plants cannot do it, only bacteria and some other thing called archaea. In the good old days, which were not so good, archaea were a subgroup of bacteria. They call them archaeobacteria or whatever, but now they are a separate category. Whatever. Natural. Clams are the best source. Mussels are also great. Liver. This is organ meat. And then fish, especially mackerel, salmon, rockfish, and crab. Next, beef, turkey, and chicken. Milk and eggs are fair. They are not as good as these, but they are okay. For example, look at the beautiful clams. Only 3 ounces of clams will give you 84 micrograms of vitamin B12. Compare that to the freaking eggs, you get only 0.3. That's a huge difference between the two.
Hey doctor, if I eat a lot of clams, will I develop chlamydia?
Oh, shut up. What are the functions of vitamin B12? DNA synthesis and therefore cell replication. Converting methylmalonyl-CoA into succinyl-CoA. The enzyme is called isomerase and the cofactor is your vitamin B12. Homocysteine into methionine, that's a methylation, so therefore the enzyme is called a methyltransferase and your cofactor is B12. Converting a pyrimidine ring into thymine, again that's a methylation reaction, you need B12. Converting the ribonucleotide into deoxyribonucleic acid, which is your DNA, you need a reductase enzyme, and you need B12 as a cofactor. Converting ethylene glycol, an alcohol, into the acetaldehyde through an alcohol dehydrogenase, it needs B12. And here is a very difficult question. Do plants contain B12? Here is what the same textbook says. B12 is present in foods of animal origins only and is not present in foods of vegetable sources. Encyclopedia Britannica says, because B12 is found in animal but not vegetable foods, strict vegetarians or vegans who do not eat dairy products, meat, fish, eggs, or vitamin B12 fortified foods may develop a deficiency if they do not receive supplements of the vitamin. Freakin' Harrison's Internal Medicine says, dietary cobalamin deficiency arises in vegans who omit meat, fish, eggs, cheese, and other animal products from the diet. The largest group in the world consists of Hindus. Subnormal serum cobalamin levels are found in 50% of randomly selected young adults Indian vegans.
So hey Medicosis, you're saying that all vegans are B12 deficient?
Oh, shut up. Look, here is the normal distribution. Imagine that this green graph is vegans and the purple one is non-vegans. If you compare them at the average, it's not big of a difference. But if you are talking to doctors who treat patients, people who have symptoms, people who have vitamin B12 deficiency that happen to be symptomatic, let's say they happen to be at the 5th percentile, so they are way below normal. At this level, you will find more vegans than non-vegans. That's it. You can eat whatever you want to eat. My job is to tell you the truth. I love you either way. And as my man Dr. Thomas Sowell said, there are no solutions in life. There are only incremental trade-offs. He said it like a boss. So, pick the trade-off that you want to live with and be happy.
But hey Medicosis, I still want to ask you, do plants contain vitamin B12?
Other sources have different opinions. The Linus Pauling Institute at Oregon University, for example, this is recommended by Professor Bruce Ames, one of the most cited scientists of all fields. Let that sink in. They said certain fermented beans and vegetables might contain B12. Mushrooms might contain B12s. UpToDate says some edible algae in Japan have B12.
Okay, Medicosis, how did they treat vitamin B12 deficiency before the era of vitamin supplements?
Organ meat, baby. The liver stores vitamin B12, so they used to feed their patients liver, and it was used to treat pernicious anemia.
But how did they discover this without a biochemistry textbook?
Trial and error, baby. Do not assume that all people that came before you are ignorant just because they didn't go to college. Get your head out of your sphincter. Also, the ancient Egyptians used liver to treat nyctalopia. What the flip is nyctalopia? Night blindness, which can be caused by vitamin A deficiency. The liver stores vitamin A because it's a fat-soluble vitamin. It also happens to store vitamin B12. That's why you can use liver to treat nyctalopia. If you want the best liver organ meat, go to Alexandria, Egypt. Do not go to a fancy restaurant. The dirtier, the merrier. Go to street pushcart peddlers. They have amazing liver meat. Great source of vitamin B12, vitamin A, and Salmonella typhi. Do not say I did not warn you. Also, it comes with a bout of gastroenteritis, or they give you your money back 100% guaranteed. The story of the B12 and the folate. So, you ate your green leafy vegetables and made your mama happy. Green leafy vegetables have folate. Here is folate. You absorb it at the jejunum, not the ileum. Okay, folate is here. Folate is methylated. So, this is methylated THF, tetrahydrofolate with methyl group. Now, methyl group is like a hot potato. Folate hates it and B12 hates it. So, folate will dump it onto the B12.
Okay, B12 is now called methyl B12.
And then B12 is gonna dump the methyl group onto the homocysteine. The homocysteine plus methyl becomes methionine. Now THF is free. Without methyl will become 5 and 10 methylene THF, and then will become dihydrofolate, and then back here. But when it goes from THF to DHF, DUMP will go to DTMP, and DTMP is important for DNA synthesis, which is important for cell division. Watch my previous video on folate to learn more. So what are the benefits of B12? We have direct benefits and indirect. Direct benefits: you can treat B12 deficiency, you can prevent megaloblastic anemia, you can treat vitamin B12 related neuropathy, dementia, and subacute combined degeneration of the cord. Hopefully you can treat it, unless it's too late. The indirect or biochemistry benefits include DNA synthesis, cell replication, converting methylmalonyl-CoA into succinyl-CoA, converting homocysteine into methionine, converting pyrimidine ring into thymine, converting ribonucleotide into deoxyribonucleic acid, and converting ethylene glycol into acetaldehyde. All of these arrows require vitamin B12 as a cofactor. Homocysteine story. Homocysteine is here. It's amazing. It has two paths. Okay, it can go this path to become methionine, and in this case we need B12, or it can go this path to become cystathionine, and in this case we require vitamin B6. What's the name of this enzyme? You want to make methionine, right? So it's called methionine synthase. Wonderful. Also, this reaction involves adding a methyl group. In order for you to go from homocysteine into methionine, you need to add methyl group. So the enzyme is called homocysteine methyltransferase because the methyl group has jumped from the homocysteine and now it's on the methionine. What's the name of this enzyme? Since you're trying to make cystathionine, it's called cystathionine synthase. No duh. What will methionine do? It will give you Sam, the ultimate methyl donor, unlike Uncle Sam who takes all of your money. Cystathionine, on the other hand, will give you alpha-ketobutyrate, which will give you propionyl-CoA, which will give you methylmalonyl-CoA, which will give you succinyl-CoA. This is a mutase, and it requires B12, by the way, and then succinyl-CoA has two options. I can go to the TCA cycle or the Krebs cycle in your mitochondria and give you energy, or if you have B6, I can make you some heme. Get some globin by combining some amino acid. Heme plus globin equals hemoglobin on your red blood cell, which transports oxygen. Now let's talk about vitamin B12 deficiency. Don't forget, it's anemia. What are the symptoms of anemia? Tired and pale, pale and tired. Sometimes I have angina, sometimes I have a headache, sometimes I have a murmur. Also dizziness, exercise intolerance, etc. So what can cause B12 deficiency? A problem in your diet, a problem with your salivary gland, problem with your stomach, a problem in your pancreas, problem with your gut bacteria, problem with your terminal ileum, or a liver disease. Problem in your diet. Why? Strict vegan. Elderly, malnourished, or breastfed baby if mommy is B12 deficient. Mommy was B12 deficient during pregnancy, and now mommy's milk is B12 deficient. Salivary gland problems, chronic sialadenitis. Here is a very important question for you. Will a patient with Sjogren syndrome develop B12 deficiency? Oh, Sjogren syndrome has chronic sialadenitis, so I think the answer is yes. Oh, shut up. Yes, it's true that Sjogren has chronic sialadenitis, but of which glands? Of the minor salivary glands. You still have your parotid, you still have your submandibular and sublingual pair of glands. You'll be fine. If you have Sjogren, you have other problems to worry about. Vitamin B12 is not even in the top 10. Stomach problems, pernicious anemia. I have nasty autoantibodies coming and destroying your parietal cells, which secrete the intrinsic factor. Now you have no intrinsic factor to bind to the extrinsic factor. What's the name of this? HCl, or hydrochloric acid, which is secreted by your stomach. But if your stomach cannot secrete it, known as chlorhydria. A means no, chlorhydria, or hypochlorhydria, you might suffer from B12 deficiency. Also gastrectomy, or during bariatric surgery when they remove the stomach. Or let's say you had chronic peptic ulcer disease, you tried everything and failed, and they just took out the stomach for some reason. All of this can lead to B12 deficiency. Pancreas, chronic pancreatitis, pancreatic insufficiency, because now you have no pancreatic amylase. Bacteria, prolonged use of antibiotics. I mean prolonged. Hey, I went to the dentist and he gave me amoxicillin 500 milligrams for 10 days. Should I be worried about vitamin B12 deficiency? Oh, shut up. I've told you your liver stores it for years. Next, the terminal ileum. Let's say Diphyllobothrium latum. A freaking parasite that lives in your terminal ileum and eats all of your B12 can lead to B12 deficiency. If you want to translate this to English, it means the broad fish tapeworm with two suckers. If you think the word suckers is not scientific, you can use slit-like grooves. Malabsorption syndrome, ileal resection. Why would I resect my ileum? Maybe you had Crohn's disease, celiac disease. All of them can affect your ileum and cause malabsorption. Liver disease, chronic alcoholism can trash your liver. Some medications can interfere with ileal reabsorption, including metformin, neomycin, cimetidine, and nitrous oxide gas, which is used by anesthesiologists, and probably Joe Rogan uses it recreationally, quote unquote. There is nothing recreational about developing subacute degeneration of the cord. Okay, we divide anemias based on the MCV into microcytic anemias, normocytic anemias, and macrocytic anemias. What is B12? B12 is macrocytic anemia, where your MCV is greater than 100 femtoliters. What are the causes of macrocytic anemia? They are divided into two categories, the megaloblastic and the non-megaloblastic. Megaloblastic include folate deficiency and B12 deficiency. What is the main difference between the two groups? This group has hypersegmented neutrophils, this group does not. Macrocytic anemia, megaloblastic or non-megaloblastic? What do I blame? Blame the DNA synthesis because it's trash. Who do I blame here? Blame your liver? What would I see here? You'll see big blasts. That's why we call it megaloblastic anemia. What would I see here? Target cells. What do you mean by big blast? Everything is big. Giant erythroblast will give you giant red blood cells or macrovalocytes. Giant myeloblast will give you giant metamyelocytes with hypersegment neutrophils. Giant hypersegment megakaryocyte maybe can give you giant platelets. Everything is big, immature, and stupid. Clinically, vitamin B12 deficiency. When you have decreased B12, you decrease your cell division. So if you injure your tongue, which you do every day, by the way, it's not going to heal. You end up with inflammation of the tongue called glossitis. And pancytopenia. What does pan mean? Extended, inclusive, everything. Red blood cells are low. White blood cells are low. Platelets are low. Anemia, leukopenia, thrombocytopenia. You get tired and pale, infections, bleeding. Symptoms of anemia include tired and pale, pan-tired, angina, flow murmur, always systolic, never diastolic, headache, dyspnea, dizziness, exercise intolerance, and hyperdynamic circulation. Anemia is a very important cause of a high-output cardiac failure, also known as hyperdynamic circulation, where everything is fast, everything is dilated, everything is distended, including your jugular veins. Cardiac output is high, heart rate is high. Preload to the left side is low, but preload to the right side is high. Blood pressure is low, afterload is low. You get a systolic flow murmur, always systolic, never diastolic. Jugular venous pressure is high. All of this is called hemodynamic instability. Now, vitamin B12 is important to make myelin. Also, if you lack vitamin B12, some toxic metabolites will accumulate and damage your nervous system or your myelin sheath. In the spinal cord, 3 areas are specifically vulnerable. The dorsal column of the spinal cord, the lateral corticospinal tract, and the dorsal spinocerebellar tract. When you damage your dorsal column, you get what? Loss of proprioception, vibration, fine touch, and fine pressure. When you damage your lateral corticospinal tract, you get what? Motor problems, weakness, usually an upper motor neuron lesion. When you tamper with your dorsal spinocerebellar tract, what do you get? Ataxia. When we combine everything together, we call it subacute combined degeneration of the cord.
Is this the most common neurological manifestation in vitamin B12 deficiency?
Shut up. The most common neurological manifestation in B12 deficiency is peripheral neuropathy. Don't be a drama queen.
What is the worst thing that can happen?
Dementia. Vitamin B12 deficiency is a preventable cause of dementia. Clinically speaking, again, related to the cause, related to the anemia, related to the B12. Related to the cause, pernicious anemia, vegan-related chronic pancreatitis, Crohn's disease, or fish tapeworm, the Diphyllobothrium latum. Related to anemia, tired and pale, pan-tired, angina, murmur, exercise intolerance, dizziness. Oh, you know this. Related to B12, glossitis, lemon yellow skin can happen in B12 deficiency, and neurological symptoms. Peripheral neuritis, the most common, subacute combined degeneration of the spinal cord, and dementia. Please make sure that your vitamin B12 level is normal. 1 multivitamin tablet a day keeps the neurologist away. Next, here is a pathway important for B12. Okay, propionyl-CoA to methylmalonyl-CoA to succinyl-CoA. We have talked about this before. We need B12 here for the freaking methylmalonyl-CoA mutase. If I have B12 deficiency, this will accumulate. I'll have increased methylmalonyl-CoA or methylmalonic acid. Increased level of MMA is a diagnostic test for B12 deficiency. This accumulation might be toxic to your nerves. Moreover, when you have B12 deficiency, there is no TCA cycle, there is no ATP, and your nervous system is gonna suffer without ATP. How can I diagnose B12 deficiency? In a nutshell, you measure the level and you measure the function. How do I level the level? Serum B12. How do I measure the function? Serum methylmalonic acid. If I have B12 deficiency, this will be low, this will be high. More labs. It's called anemia. Hemoglobin is low, hematocrit is low. It's called a macrocytic anemia. MCV is high. Is this hemolysis? No, therefore reticulocytes are low. How about pancytopenia? Everything is low. Serum B12 is also low. Peripheral smear, macrovalvocytes, everything is big, crazy, and stupid and immature. Hypersegmented neutrophils and pancytopenia. Serum homocysteine is high. Serum MMA is high. You get neurological symptoms. Historically, we use the Schilling test. I have a video on this on my YouTube channel. And autoantibodies to intrinsic factor if the patient has the autoimmune pernicious anemia. Please watch my video on the Schilling test to know more. There are no solutions in life. There are trade-offs. Even this lab test is not very accurate. Sometimes you get falsely low level. This will give you a patient who seems deficient but is actually fine. Example, multiple myeloma, HIV, or contraceptive pill, pregnancy, and phenytoin. They can give you a falsely low level of serum B12. A falsely high level can happen with malignancy, myeloproliferative neoplasms such as polycythemia vera, essential thrombocytosis, etc., kidney disease, and alcoholic liver disease. Treatment: if the patient lacks B12, give the patient B12. No kidding. For how long? It depends. Let's say that you gave to the patient for like 5 months and then the symptoms disappear, the labs normalize. That's fine. The patient's perfect now. But if the patient removed the stomach or remove the ileum, this patient will require lifelong therapy with B12. You can give the patient cyanocobalamin or hydroxycobalamin. Which one is better? We said the hydroxy is better. In the United States, they tend to use this. In Europe, they tend to use this. Hats off to Europe because hydroxy is better. Differential diagnosis of vitamin B12. It depends on differential diagnosis of hypersegmented neutrophils, differential diagnosis of pancytopenia, differential diagnosis of neurological findings. Please read these, very important. Some pearls for the pros. Increase folate in your blood. For example, if you take too much folate supplements, can mask the hematological symptoms of B12 deficiency, but it cannot mask the neurological symptoms of B12 deficiency. This is very important. Here's an existential question. Why does B12 deficiency cause neurological symptoms such as peripheral neuropathy, subacute combined degeneration of the spinal cord, and dementia? But folate deficiency does not cause this, even though deficiency of either B12 or folate can lead to megaloblastic anemia. Why? The answer is called the Newig's hypothesis. According to this doofus, you have precursors that will become uracil, and then uracil will become thymine, and then thymine will give you DNA. DNA will give you cell division and doozy red blood cells. But the uracil can also go into another path and give you RNA. RNA will give you proteins. Protein will give you the myelin and the sphingomyelin and all of the stuff, and will give you robust myelin sheath and robust spinal cord. This step requires B12. This step requires folate. Let's say I have folate deficiency. Okay, no folate. Therefore, no thymine, no DNA, no red blood cells. Hashtag megaloblastic anemia. However, your spinal cord and nerves are fine. But if you have B12 deficiency, red blood cells have a problem called megaloblastic anemia, and your nervous system has a problem called peripheral neuropathy, subacute combined degeneration of the cord, and dementia. This is not a doofus, that's a great scientist, I'm just joking. Pregnant mothers should start taking folate even before thinking about getting pregnant. Why? To prevent neural tube defects, which happen in the first trimester. Pregnant mothers should also take vitamin B12. Why? To prevent neuropathy and demyelination, which probably start here or after delivery. Because if mommy is B12 deficient, the baby will be B12 deficient in the womb and B12 deficient during breastfeeding because mommy's breast will be B12 deficient. Let's compare between folate deficiency and vitamin B12 deficiency. Anemia happens in both. How about hemoglobin and hematocrit? Low in both. Which type? Macrocytic megaloblastic in both. MCV, high in both because it's macrocytic. Reticulocytes, low in both because it's not hemolytic. Pancytopenia can happen in both because there is no DNA synthesis. Neurological symptoms only with B12. But if you're talking about neural tube defects in utero, it's only with folate. Homocysteine is high in both, but methylmalonic acid is only high in vitamin B12. And the mnemonic is, with vitamin B12, both are high, but with the freaking folate, only homocysteine. Let's say I have achlorhydria like freaking Rasputin. I will only have vitamin B12 deficiency. How about autoantibodies? Only vitamin B12 deficiency. This is called pernicious anemia. Atrophic gastritis, only B12 deficiency. Gastric adenocarcinoma, B12 deficiency. Serum gastrin, B12 deficiency. What the flip does that even mean? Hey, what's the normal function of gastrin? Normally is to boost gastric motility and secretion. But if your stomach has a problem and is not responding, what's going to happen to serum gastrin? it's gonna increase. It's a negative feedback. How do I treat folate deficiency? Treat the underlying cause, give folate. B12 deficiency, treat the underlying cause, give B12. If you like this video, you will love my antibiotics course even more. Go to medicosisperfectionalis.com. It has 40 videos about antibacterials, antifungals, antivirals, and antiparasitic medications. You can use the promo code HAVE to get a 50% discount. It's available for 10 students only. Thank you for watching. Please subscribe, hit the bell, and click on the join button. You can support me here or here. Go to my website to download my premium courses. This is Medicosis Perfectionalis, where medicine makes perfect sense. As always, be safe, stay happy, and study hard. I love you.